Have you ever noticed how a simple headache or a moment of dizziness can be brushed off in just seconds? What if I told you that, for many seniors, these tiny signals might be the body's final warning before a stroke strikes? Strokes don't always announce themselves with drama. They sneak in, quietly, like a thief in the night. In this video, we're uncovering the truths about strokes that every person over 60 must know. No sugarcoating, no complicated medical terms, just clear, helpful facts. The kind that might save a life, maybe even yours or someone you love. We'll walk through what a stroke really is, what causes it, how to spot it before it's too late, and most importantly, what you can do today to reduce your risk. Because the truth is simple, most strokes are preventable. So sit back, take a deep breath, and let's take this journey together. Stay with me until the end of this video, because just a few minutes of attention today could protect a lifetime for someone you love, or even for yourself. What is a stroke? When blood flow stops. Imagine the brain as a city. Every second, millions of messages travel like cars on highways, fast, precise, and constant. Now picture a sudden traffic jam, a major road blocked. No cars can pass through. Chaos spreads. Lights go out. Alarms sound. That's what a stroke is. A stroke happens when the brain's blood supply gets interrupted. Without oxygen-rich blood, brain cells begin to die within minutes. There are two main types. Ischemic stroke, the most common one. It occurs when a blood clot blocks a vessel in the brain. Think of it like a pipe clogged with dirt. Hemorrhagic stroke, less common but more deadly. This one happens when a blood vessel bursts, flooding the brain with blood. In both cases, the result is the same: brain damage. And because the brain controls everything, speech, movement, memory, a stroke can rob a person of their ability to speak, walk, or even recognize loved ones. Let me be clear, the effects of a stroke can be devastating, but they don't have to be inevitable. We now understand much more about how strokes work, and the sooner we act, the better the chances of recovery or prevention altogether. So what causes this silent killer? That's what we'll uncover in the next part. Common causes of stroke in older adults. Let's face it, stroke doesn't just happen out of nowhere. It builds up silently, like a storm gathering on the horizon. And if we're not paying attention, it strikes without warning. So what exactly sets the stage for a stroke, especially in older adults? The truth is, stroke isn't caused by just one thing. It's often the result of several risk factors, many of which can go unnoticed for years. Here are the top culprits. High blood pressure. This is the #1 cause. When blood pressure stays too high for too long, it weakens artery walls. One sudden spike can cause a rupture or blockage in the brain. Diabetes. High blood sugar damages blood vessels over time, making it easier for clots to form. High cholesterol. Too much bad cholesterol can clog arteries, especially those that feed the brain. Heart conditions. Problems like atrial fibrillation cause blood to pool and form clots that can travel to the brain. Smoking each cigarette narrows blood vessels and thickens the blood, increasing stroke risk. Excessive alcohol. Drinking too much raises blood pressure and weakens the heart. Sedentary lifestyle. Lack of movement contributes to weight gain, high sugar, high pressure, all bad news for the brain. Poor diet, processed foods, too much salt, and lack of fruits and vegetables increase nearly every stroke risk. The good news? Most of these are preventable. They may seem small, but they add either to danger or to protection, depending on the choices we make each day. And for seniors, paying attention to these causes could mean the difference between a long, healthy retirement or a life of dependence. Next, let's look at the warning signs that stroke might already be on the way. Stroke warning signs. Even one small clue matters. What if your body could whisper to you before a stroke hit? What if there were early warning, signs brief, subtle, offering you a chance to act in time? The truth is, the body does send signals. But the problem? We often ignore them or mistake them for something harmless. Let's uncover the key warning signs of stroke you should never ignore. Sudden weakness or numbness, especially on one side of the body, arm, leg, or face. If one side of the face droops when smiling, or one arm drifts down when both are raised, this is a red flag. Confusion or trouble speaking. The person may slur words, say the wrong thing, or not understand simple sentences. Vision problems. Sudden blurry or double vision, or even temporary blindness in one eye. Dizziness or loss of balance. If walking becomes difficult or the person suddenly falls without explanation. Severe headache with no known cause. This can signal a brain bleed. It often comes on fast and feels different from regular headaches. Here's a simple way to remember these symptoms. Fast. F. Face. Ask the person to smile. Is one side drooping? A. Arms. Can they raise both arms? Does one drift down? S. Speech. Can they speak clearly, or is it slurred? T. Time. If you see any of these signs, time is critical. Call emergency services immediately. Every second counts. The faster you act, the better the chances of recovery and survival. So next time you notice something off, especially in someone over 60, don't wait and see. Trust your instincts. Take action. Life, after stroke, nothing feels the same again. What happens after a stroke? The lucky ones survive, but the journey doesn't end there. In fact, for many, that's where the real battle begins. A stroke doesn't just strike and leave, it often lingers in the form of life-altering complications. Some fade with time and therapy. Others stay for life. Let's explore the most common complications stroke survivors face. Paralysis or movement problems. One side of the body may lose strength or coordination. Walking, eating, even brushing teeth can become daily challenges. Speech and language difficulties, known as aphasia. Some people can't form words. Others understand speech but struggle to respond. Imagine knowing what you want to say, but not being able to say it. Frustrating, right? Cognitive changes, memory loss, difficulty focusing, or trouble making decisions. It's like the brain's clarity gets dimmed. Emotional disturbances, depression, anxiety, even sudden mood swings are common. The brain, after all, is not just a physical organ, it's the seat of emotion, pain, or unusual sensations. Some stroke survivors feel pain, burning, or tingling in affected limbs. It's a kind of nerve confusion signals firing the wrong way. Swallowing difficulties, dysphagia. This isn't just about discomfort. It can lead to choking or aspiration pneumonia if not managed. These complications don't just affect the stroke survivor. They affect families, caregivers, and the rhythm of an entire household. But here's the truth. Recovery is possible. It may take time, it may take patience, but many people regain their independence step by step, word by word, day by day. And the earlier a stroke is treated, the fewer these complications tend to be. Stroke prevention, small changes, big impact. Here's a question. What if you could avoid a life-changing stroke not with expensive treatments, but with small daily habits? Sounds too simple? Yet that's exactly what science and doctors keep telling us. Preventing a stroke starts long before any symptoms appear. Let's dive into what you can do, starting today. 1. Manage your blood pressure. This is number one for a reason. High blood pressure silently damages blood vessels, making them more likely to burst or get blocked. Tip: aim for regular checkups, reduce salt, and move your body every day. 2. Control blood sugar if you have diabetes. Uncontrolled diabetes damages arteries and increases stroke risk. If you're over 50, it's wise to check your fasting glucose yearly, even if you feel fine. 3. Watch your cholesterol. Too much bad cholesterol, LDL, can clog arteries. It's like pouring grease into a narrow pipe. It eventually gets blocked. Choose healthy fats like olive oil, avocado, and eat more fiber. 4. Quit smoking. Nicotine thickens your blood and narrows your arteries. Quitting isn't easy, but your brain and your heart will thank you. 5. Move your body, even gently. Daily walking, stretching, or Tai Chi can improve circulation and reduce stroke risk dramatically. You don't need a gym, just consistency. 6. Eat for your brain. Leafy greens, berries, whole grains, and fish like salmon or sardines are known to support brain health. Try to limit processed foods, sugary drinks, and excess red meat. 7. Sleep and stress. Chronic stress and poor sleep hurt your blood vessels. Wind down each night. Breathe deeply. Avoid screens before bed. Yes, even your phone. 8. Limit alcohol. A glass of red wine? Maybe. But heavy or regular drinking? It's not doing your brain any favors. 9. Regular checkups. Especially after age 55. A yearly checkup with blood pressure, cholesterol, and glucose screening can catch risks early. 10. Know your family history. If stroke runs in your family, start prevention even earlier. Talk to your doctor about a custom plan. What to do when stroke strikes. The right move could save a life. Imagine this. You're having tea with your father, and suddenly he drops his cup. His words become slurred. He tries to stand but loses balance. What would you do? Most people panic, or worse, wait. But when it comes to stroke, every second counts. Fast action means less damage, more recovery, and higher chances of survival. Let's go through exactly what to do step by step. 1. Learn to spot the signs fast. Use the FAST method. F. Face. Ask the person to smile. Is one side drooping? A. Arms. Ask them to raise both arms. Is one arm weak or drifting? S. Speech. Ask them to repeat a sentence. Is the speech slurred or strange? T. Time. time to call emergency services immediately. Even if you're not sure, call for help right away. Don't wait to see if the symptoms go away. 2. Call for emergency help, such as 911. Do not drive them to the hospital yourself. Stroke patients need specialized care on the way. Every minute matters. 3. Don't let them sleep or talk you out of it. Many stroke victims feel confused, but think they're okay. Gently insist on getting medical help immediately. Their life may depend on it. 4. Don't give them food, drink, or medication. They might choke. Let medical professionals handle this. 5. Note the time. If you saw exactly when symptoms started, tell the doctors. This helps decide which treatment they can safely use. 6. Stay calm and stay with them. Your presence helps them feel safe. Keep them lying down with the head slightly elevated if possible. You don't need to be a doctor to save a life. You just need to recognize the signs and act fast. Stroke doesn't knock, it crashes into our lives when we least expect it. But now, you're no longer unaware. You've learned what causes it, how to recognize it, and what steps to take immediately. That knowledge alone can be the difference between life and loss. So, ask yourself, what's a few minutes of awareness compared to a lifetime of love and health? If this video helped you understand stroke better, please consider subscribing to our channel. Leave a comment, maybe share your own story, or ask a question, and hit the like button so more people can benefit from this message. Most importantly, don't keep this information to yourself. Share it with your parents, your siblings, your friends, because the life you save might be someone you love deeply. Thank you for staying with us until the end. Take care, stay safe, and we'll see you in the next video.